The 3M V.A.C Veraflo Cleanse Choice Dressing is specifically designed for use with 3M Veraflo Therapy. The foam is less hydrophobic than other V.A.C therapy dressings, which helps facilitate even distribution of topical wound solutions. V.A.C Veraflo Cleanse Choice Dressing also has increased tensile strength and may be used with explored tunnels or undermining where the distal aspect is not visible. V.A.C Veraflo Cleanse Choice Dressings are available in medium and large sizes to accommodate various wound sizes and minimize waste. The V.A.C Veraflo Cleanse Choice Dressing is composed of 3 separate pieces of foam: a wound contact layer of V.A.C Veraflo Cleanse Choice Dressing with 1 cm holes, a thin cover layer of V.A.C Veraflo Cleanse Choice Dressing without holes, and a thick cover layer of V.A.C Veraflo Cleanse Choice Dressing without holes. The wound contact layer and at least 1 cover layer are required to dress the wound unless tunnels or undermining are present. The choice of cover layers depends on the depth of the wound. All V.A.C Veraflo Cleanse Choice Dressing kits contain the 3 foam layers, 3M Cavalon No Sting Barrier Film, 3M V.A.C Ruler, 3M V.A.C Advanced Drape, and the 3M V.A.C Veratrac, an all-in-one system that incorporates tubing for fluid input and tubing for exudate and fluid removal through a single pad interface. The large size kit includes the 3M V.A.C Veratrac Duo Tube Set, which consists of 2 pads, the Instill Pad for fluid installation and the SensorTrack pad for fluid and exudate removal. Before applying a new dressing, remove and discard the previous dressing per institution protocol. Thoroughly inspect the wound to ensure all pieces of dressing components have been removed. Ensure debridement of all necrotic, non-viable tissue, including bone, eschar, or hardened slough, as prescribed by the physician. Perform a thorough wound and peri-wound area cleaning per physician order or institution protocol prior to each dressing application. Protect fragile or friable peri-wound skin with medical-grade transparent film, skin protectant, or hydrocolloid. Make sure the skin is clean and thoroughly dry prior to applying the Cavalon No Sting Barrier Film. Use the wipe to apply a uniform coating of film over the desired area. Allow to dry thoroughly before applying the drape. Ensure adequate hemostasis has been achieved. Assess wound dimensions and pathology, including the presence of undermining or tunnels. Do not place any foam dressings into blind or unexplored tunnels. Select the wound contact layer and either the thick or thin cover layer, depending upon the wound depth. Size the dressing layers as needed to allow gentle placement into the wound without firm packing of the foam or overlapping onto intact skin. Gently place the foam into the wound cavity, covering the entire wound base and sides, tunnels, and undermine areas in the following order. As required, use a cover layer to fill explored tunnels and undermine areas. Place the wound contact layer with holes directly into the wound bed. Place the selected cover layers over the wound contact layer with holes. Trim the V.A.C Advanced Drape to cover the foam and an additional 3 to 5 cm border of intact peri-wound tissue. The V.A.C Advanced Drape may be cut into multiple pieces for easier handling. Carefully remove layer 1. To expose the adhesive, hold the drape with the ruler handling bars. Place the adhesive face down over the foam and apply the drape to cover the foam and intact skin, ensuring at least a 3 to 5 cm border of intact peri-wound tissue. Remove layer 2 and pat the drape to ensure an occlusive seal. Remove the ruler handling bars. Choose an appropriate location for the V.A.C Veratrac pad. Pay close attention to the tubing positioning to allow for optimal flow. Pinch the V.A.C Advanced Drape and carefully cut a 2.5 cm hole, not a slit, through it. The hole should be large enough to allow for removal of fluid and exudate. You do not need to cut into the foam. Next, remove both backing layers 1 and 2 from the pad to expose adhesive. Place the pad opening directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. When using the large V.A.C Veraflo Cleanse Choice Dressing, apply the V.A.C Veratrac Duo Tube Set. Choose the Instill Pad Application site. Pinch the V.A.C Advanced Drape and carefully cut a 2.5 cm hole, not a slit, through it. The hole should be large enough to allow for removal of fluid and exudate. You do not need to cut into the foam. The Instill Pad has a central disc and a surrounding outer adhesive skirt and the smaller diameter tube. To apply, remove both backing layers 1 and 2 to expose the adhesive. Place the pad opening in the central disc, directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. Now choose the pad application site for the SensorTrack pad. Pay close attention to fluid flow and tubing positioning to allow for optimal flow. Pinch the V.A.C Advanced Drape and carefully cut a 2.5 cm hole, not a slit, through it. The hole should be large enough to allow for the removal of fluid and exudate. You do not need to cut into the foam. Apply the SensorTrack pad, which has a central disc and a surrounding outer adhesive skirt. Remove both backing layers 1 and 2 to expose the adhesive. Place the pad opening in the central disc directly over the hole in the drape. Apply gentle pressure on the central disc and outer skirt to ensure complete adhesion of the pad. Pull back on the blue tab to remove the pad stabilization layer. You are now ready to connect the V.A.C Veraflo Cleanse Choice Dressing to the V.A.C Ultra Therapy system. Please watch the Veraflo Therapy on the V.A.C Ultra 4 Therapy System video for further instructions on initiating Veraflo Therapy. Remember to keep therapy on for a minimum of 22 hours per day. Dressings should be changed every 48 to 72 hours, but no less than 3 times per week or as ordered by the clinician. For more product demos and application techniques, visit 3m.com/medical.